Hospice care is meant to be a gentle transition, a place where pain is eased and dignity is preserved. In the quiet halls of Sakura Hills Hospice, families trusted their loved ones were in good hands. Nurses were seen as angels, offering comfort in the face of loss. But in autumn 2024, unease crept in. The number of deaths began to rise, subtly, quietly. Patients who seemed stable would suddenly pass away. Death was expected here, but these endings felt abrupt, unnatural. Dr. Kenji Tanaka, a veteran in palliative care, sensed something was wrong. He noticed these were not the slow declines he knew so well. Instead, lives were ending like a light switched off. He began to scrutinize patient charts, searching for a pattern. Raising suspicion against a caregiver was unthinkable, but the evidence was mounting. The administration hesitated, fearing panic and reputational damage. Still, Dr. Tanaka pressed on, presenting 3 cases in 1 month, patients stable, then gone within hours. The only common thread was not their illness, but something hidden in the ward's routines. Staff began to whisper. They too noticed the trend. Dread replaced the usual somber acceptance. Families started asking questions, their grief now mixed with suspicion. Was something sinister happening in this place of peace? The administration could no longer ignore the signs. An investigation was launched. The quiet ward was no longer just a place of rest. It was a place of suspicion. The staff watched each other, trust eroding. The sanctuary had become a stage for fear. The question was no longer if something was wrong, but who was responsible. The quiet was broken. The ward was listening. The investigation started with data. Dr. Tanaka and administrators charted every death over 18 months, cross-referencing with staff schedules. A disturbing pattern emerged. Deaths spiked during night shifts, especially when one nurse was on duty. Her name was Akari Sato. Akari, in her late 30s, was known for her calm and efficiency, often volunteering for the night shift. On paper, she was exemplary, but the numbers told a different story. Mortality rates doubled on her shifts, especially between 2 and 4 a.m. The pattern was too strong to ignore. Police joined the investigation, digging into Akari's past. At 2 previous care facilities, similar spikes in deaths had occurred during her shifts. She left both jobs after internal reviews began. The pattern had followed her. The focus narrowed. Akari Sato was now under discreet surveillance. Colleagues described her as hard-working, but emotionally distant. While others grieved, Akari remained unaffected. What once seemed like professionalism now looked suspicious. The data had given the darkness a face. The question shifted, not if, but how. How was she doing it? The investigation intensified. The staff watched her every move. The truth was closing in. Investigators turned to the IV logs, searching for Akari's method. Every medication and flush is supposed to be recorded, but Akari's logs stood out. She flushed IV lines far more often than her peers, sometimes with unusually large volumes. Empty 50-milliliter syringes were found after her shifts, an oddity in standard care. Akari explained them away as routine, but the pattern was troubling. Gaps in her records suggested more than clerical errors. The prosecution would later argue these syringes were her weapon. They theorized she wasn't flushing with saline, but with air. A large syringe could silently deliver a fatal bubble into a patient's bloodstream. The logs, with their strange entries and omissions, became silent witnesses. The method was invisible, deadly, and left no chemical trace. In the quiet of night, death could be delivered in seconds. The evidence was mounting. Air, essential to life, can also be a weapon, an air embolism. When air enters the bloodstream, it can block the heart or lungs, causing sudden death. For healthy people, small bubbles are harmless, but hospice patients are fragile. A large bolus of air, like that from a 50-milliliter syringe, is lethal. The effect is swift chest pain, gasping, plummeting blood pressure, cardiac arrest. To an observer, it looks like a natural death, heart failure, or a massive heart attack. Akari's weapon was perfect, silent, invisible, and mimicking the symptoms of terminal illness. She could act during a routine check, under the guise of care. The patient, sedated or asleep, would never know. No one would suspect. The prosecution's theory was chillingly simple. Akari had found a way to kill without leaving a trace. The night shift became her cover. Death, disguised as mercy, walked the halls. The invisible weapon was real. Proving air embolism is difficult. The evidence vanishes quickly. Investigators needed an expert, Dr. Masayuki Ito, a renowned forensic pathologist. He exhumed 3 patients who died under Akari's care. Using a special technique, he submerged the chest cavity in water and cut into the heart. Bubbles rose, proof of air trapped inside. This was not decomposition, it was evidence of murder. All 3 bodies showed the same signs. Air in the heart, no other cause of death. The hearts showed distress, but no clots or fluid in the lungs. Toxicology was clean. The only explanation, massive, deliberate air embolism. In court, Dr. Ito's testimony was clear and devastating. He described the bubbles, the science, and the certainty of homicide. The defense tried to challenge him, but his methods were unassailable. He gave voice to the silent victims. The morgue's whispers became a roar in the courtroom. The evidence was undeniable. The truth could no longer be buried. Justice demanded to be heard. The trial revealed 2 faces of Akari Sato. The prosecution called her a cold killer, the defense, a compassionate nurse caught in a nightmare. Co-workers' testimonies were divided. Some saw her as an angel, calm, dedicated, always there for dying patients. Others described her as robotic, emotionally vacant, unaffected by death. One nurse recalled Akari calling a patient a burden, a comment dismissed at the time but chilling in hindsight. Families, too, were split. Some remembered her kindness, others felt uneasy. One patient, lucid until her final hours, told her son, "That nurse scares me." The jury heard stories of comfort and stories of dread. The angel and the shadow warred in the courtroom. Was Akari a healer or a predator? The answer was elusive. The community was divided. The truth seemed to shift with every testimony. The jury faced an impossible choice. The fate of Akari Sato and the meaning of trust hung in the balance. The final arguments painted Akari as either a savior gone astray or a scapegoat for a broken system. The prosecution suggested a twisted compassion or a need for control. The defense called it tragic coincidence. Akari remained silent, her face unreadable. The jury found her guilty on 3 counts of murder. She was sentenced to life in prison. The verdict brought closure, but also a deep sense of betrayal. The case shook the nation's faith in hospice care. New protocols were introduced, stricter IV documentation, cameras in medication rooms, smart pumps, and better night staffing. The case forced a painful reckoning. Compassion and trust are vital, but so is vigilance. The legacy of Sakura Hills is a somber lesson. Even in places of peace, darkness can hide. Only constant watchfulness can keep it at bay.